The Little Switzerland FFA at Waukon Veterinary Science Team is pleased to present our clinical procedure practicum video over surgical preparation. Members of this team include Chase Platson as our veterinarian, Carmen Willie as our veterinary technician, Austin Day as our videographer, and Danny Stock as our narrator. Preoperative preparations are important to ensure the removal of soil and microorganisms from the skin, as well as reduce residual microbial count to subpathogenic levels in a short amount of time, with the least amount of irritation to the tissue. And finally, we hope to inhibit any rapid growth of microorganisms that could cause infection. According to Merriam-Webster's Medical Dictionary, the term sterile is defined as being free from living organisms and especially microorganisms. Sterile preparations begin after the animal, in this case our dog, is placed in the correct position for the surgical procedure.
For this procedure, we used a number 40 clipper blade and clipped from the xiphoid to the pubis bone. And then we used chlorhexidine gluconate and distilled water. We did that 4 times to make sure it was sterile, and then mixed with alcohol for our final antibacterial prep.
As our veterinary technician stated, she has already clipped the hair of the dog with a number 40 surgical blade. This preparation is done in a different room to ensure the hair of the animal does not contaminate the operating room. Clipping the hair is done to reduce contamination of the surgical site. She has also restrained the dog on the operating table, securing all 4 legs of the dog to ensure the dog does not move during the procedure. Prior to the beginning of our surgical preparation, we have placed chlorhexidine gluconate scrub in a bowl that included several gauze pads that will be used during the preparation. The other bowl contains gauze soaked in distilled water that will be used during the procedure. Our veterinarian is now ready to begin the surgical preparation of our patient. To begin, our veterinarian will obtain a gauze pad soaked in chlorhexidine gluconate scrub with his left hand, releasing some of the liquid. He will then transfer the gauze pad to his right hand, which will be the hand responsible for scrubbing the surgery site. He will place the gauze pad just below the navel of our patient and will scrub the incision area, being sure you do not stray from the incision site. It is recommended that the incision area be scrubbed for 2 minutes to ensure the area is clean. Our veterinarian will then move in a counterclockwise fashion away from the incision area. He is careful that he does not overlap an area he has previously scrubbed. You will notice that partway through the initial scrub, our veterinarian hits a portion of the dog's body that is not included in our surgical preparation area. Due to this, our veterinarian must start the initial scrub over, and he starts over with a chlorhexidine gluconate scrub gauze. Upon completion of the chlorhexidine gluconate scrub has been applied, our veterinarian will again use his left hand to obtain a gauze pad soaked in distilled water and transferred to his right hand. He will then scrub the incision area first and work outward in a clockwise fashion. The scrubbing procedure will be completed 4 times to ensure the surgical site is free of any contaminants that could cause infection to our patient. If excess dirt is observed during the scrubbing procedure, the veterinarian will continue to complete the procedure until the gauze pad appears free of dirt. You will notice the position of our veterinarian. He keeps his hands above the patient and never allows his hands to drop to his sides, even when disposing of the gauze pads. Between each scrub, he keeps his hands above the patient. Once our veterinarian has completed all 4 scrubs, he will then apply a final antiseptic spray using a spray bottle containing a solution of 0.5% chlorhexidine gluconate and 70% isopropyl alcohol. At this point, the veterinarian has completed the scrubbing procedure and is ready to drape the patient for surgery. Our veterinarian has now completed the steps used in surgical preparation. The use of this technique is to ensure the removal of soil and microorganisms from the skin, as well as reduce the residual microbial count to subpathogenic levels in a short amount of time, with the least amount of irritation to the tissue. And finally, we hope to inhibit any rapid growth of microorganisms that could cause infection to ensure a healthy and speedy recovery for our patient. like to thank you for watching the Waukon FFA present our video on surgical preparation. We would also like to give a special thanks to Dr. Mark Brodel and Tyler O'Neill for their assistance in the production of our video.